Hello guys, so let's start the high yielding stuff part 4. So this is Dr.Shivaam Kesarwaani and I am here to play the number game with you. As your NEET PG is very fond of asking number MCQs with you, so here I am presenting with you some basic number MCQs from ENT section. So without wasting time, we start the game. Total area for the tympanic membrane, that is the flaccida and tensa, combinedly is 90 millimeters of squares. Flaccida consisting of 30 millimeters squares and tensa consisting of 60 millimeters of squares. Diameter is 10 millimeter, while the thickness of tympanic membrane is only 0.1 millimeter. Diameter of oval window is 1.75 millimeter. Thickness of lateral wall of mastoid along with the volume. So you must know this, that both are 15. That is 15 millimeter the thickness and 15 millimeter cube is the volume. Rate of growth of thickness, if someone asks you, the rate of growth of thickness of mastoid from newborn to adult size is 1 millimeter per year, and hence to attain the adult size, that is of 15 millimeter, we will require 1 millimeter into 15, that is 15 years to attain adult size of mastoid. Now another question is about the pinna, which achieves its adult size by 6 years of age. Now you must also know the adult configuration is reached in the intrauterine life itself, that is the 20th week of intrauterine life, 5th month of intrauterine life. The pinna achieves the adult configuration. The development of larynx by 4 weeks. X-ray appearance of different sinuses. So we have different important function as sinuses. The mastoid appears on X-ray by 4 months. The ethmoid by 1 year, the sphenoid by 4 years, and the last to appear on X-rays is the frontal sinus, which appears by 6 years of age. Can you believe this? So mastoid by 4 months, the earliest, ethmoid by 1 year, and you must also know that the mastoid and the ethmoid are present from birth, these two sinuses. So mastoid on X-ray appears by 4 months, ethmoid by 1 year, sphenoid by 4 year, and the last to appear is on X-ray is frontal, that is by 6 years of age. Now just one repeat NEET PG type of question is Miller's sign, which indicates difficult airway in case of mandibulofacial dystosis. Now Bouchard's triad is for gastric valvulus, which includes acute epigastric pain, inability to pass a nasogastric tube, and violent vomiting. Now one question which is being repeatedly asked by your examiners is increase in risk of HIV transmission due to breastfeeding. Here you need to put focus over the question, the framing of the question basically. So here it is asking increase in risk of HIV transmission due to breastfeeding. So it will be 5 to 15%. But if you see, if the examiner asks what is the risk with breastfeed, so it is 20 to 45%. The risk is with breastfeeding, the risk of HIV transmission, guys, is 20 to 45%. And if you see without breastfeeding, there always lies a risk transmission of HIV. So what is it without breastfeeding? So it is 15 to 30%. So if you subtract with breastfeeding from without breastfeeding, you will get the net increase in risk of HIV transmission due to breastfeeding will be 5 to 15%. Now phototherapy, the range of light given is between the 425 to 475 millimeter, and if you see in lux, it is 6 to 12 microwatts per centimeter square per nanometer. Now distance from the tube light is 40 centimeter. Now this I didn't find any more space in this space to include more data. However, one more data is I have included it, that is the 1 gram of hemoglobin liberates 34 milligram of bilirubin, while 1 gram per dl of albumin binds with 8 milligram of bilirubin. Now there are many number MCQs which you need to revise frequently for your NEET PG exam, as they will be asking around 7 to 8 only database question, that is the number based question. So I will try to cover all of the number based question for you all, so that you cannot miss or you do not miss those important valuable 7 to 8 questions. So all the best to you. I'll be coming with the other high yielding stuffs as I get time. So do subscribe, like and comment, and it feels motivated to read your comments and seeing your likes. And thank you, and stay motivated, study hard. All the very best.